So hi everyone, my name is Jasmine Swanner Yap, your second year student nurse from Leopold'S College. And today I am going to perform the Leopold'S maneuver. So the maneuver is a standard palpation of the abdomen for assessing the fetal position, presentation, and degree descent. So now first things first is to perform the hand washing to prevent the spread of the microorganisms. Then greet the client politely, then introduce yourself, verify the client using the two identifiers and ask how the client and how she would like to be called during the assessment. And don't forget to establish good rapport so that the client won't feel uncomfortable. Then now explain the procedure to the client and give the client the opportunity to ask or raise for her concerns. So this procedure can be performed with a full bladder, so let the patient empty her bladder first before the procedure, because emptying your bladder promotes comfort, and of course it allows a productive palpation because fetal contour will not be obscured by a distended bladder. Hello ma'am, may I come in? So asking the patient's consent is necessary. So hello ma'am, my name is Franz, your attending nurse for today. So first, may I know your name? Okay, so when is your birthday? So is that okay that I'm going to check for your wristband? Okay. So by the way, the procedure that I will be doing is that I am going to perform the Leopold'S maneuver to you to determine the position and light of your baby inside your tummy. So I am going to touch some parts of your body. So is that okay with you? Okay, so do you have any clarifications or concerns? Okay, so let's empty your bladder first, ma'am. So as you can see, ma'am, the curtains are closed so that there will be the other people who can see us. And of course, I will assure you that this won't hurt you and your baby, so don't worry. So before the procedure, ma'am, or the assessment, do you feel any pain or are you uncomfortable? Okay, so let's start right away. So the first thing to do is to position the patient into a supine position with a pillow under her head and with his knees slightly flexed. This is done for us to facilitate the accurate assessment. Then giving comfort and with slightly flexed knees can relieve the tension of abdominal musculature. If you are right-handed, stand at the patient's right and slightly lift her shirt and expose the specific area only. And do not forget to ask permission before doing so. So ma'am, I am going to expose your abdominal. Is that okay with you? Okay. So now let's do the first maneuver. So face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. So this is to determine if the baby's head feels hard, round, freely movable, and ballotable, and of course the nodular is softer. For the second maneuver, palpate in a downward direction on the side of the abdomen by applying a gentle but deep pressure for us to determine the position of the fetal extremities, fetal back, and anterior shoulder. Of course, this is to determine if the fetal back is in a continuous structure and side of extremities feel nodular and reflects the portion of the fetal. So now for the third maneuver, place one hand into a symphysis pubis and grasp the lower uterine at the segment between the thumb and the fingers feels the presenting part. This is for us to determine if the engagement has occurred and of course if the fetum feels in the pelvis. Also, if the head of in the pelvis is in 0% presenting part and still movable, this means this is not yet engaged. So in the fourth maneuver, turns and face the patient feet to confirm the findings into the third maneuver and determine the flexion of the fingers into the pelvis. This is for us to know if the cephalic prominence is felt on the side where there is a greater resistance to the descent of the vertex. Then locate the back of the fetus, then place the stethoscope over it. And listen for the fetal heart tone in 1 full minute. And for us to know if the baby's heart is normal, we should hear a 120 to 160 beats per minute. So note for the location, rate, character of the fetal heart tone for documentation and record afterwards. Make sure that the patient is comfortable and document the observation made, the fetal findings and presentation, position, attitude, and whether the engagement or a floating to promote the database for the future. And after finishing the procedure, do not forget to wash our hands. Today, I examined Blue, a 26-year-old at a 21 weeks and 5 days with her first pregnancy. So upon the palpating, it was soft and non-tender. The baby's head feels hard, freely movable, and the structures felt at the side of the fetal back. So the extremities feel the nodular, and it reflects the portion of the fetal. The presenting part is still movable, which means it is not yet engaged. The cephalic prominence is felt on the side where there is a greater resistance of the descent of the vertex. And the fetal heart tone is 125 beats per minute.